Class we are going to understand about the difference between an what? Audiologist and an ENT specialist. How are these two fields different and what is the role of these two fields? As I said, a person having hearing loss would be approaching an ENT or an audiologist, correct? The key word was structure and function. Structure means the anatomy of it and function means how it works or the physiology of it. Right? By seeing this hand, can you say whether this hand is of an artist? Can you say yes, no? No. By seeing this, can you say whether this is a normal hand or not? Yes. So any deviation in this hand, the structure of the hand is deviated. This can be corrected either through any surgery or through medicines. It can happen that this cannot be corrected. So this remains and the person has to learn how to live with it. Now, structure part of it. The function is, if I want this hand to become the hand of an artist, then this needs to be trained and retrained. So for that you will be requiring some therapy and therapeutic intervention which is non-medical in nature. Furthermore, if the hand has some deformities and still a particular work has to be done, still the person has to be trained and retained so that this hand can be used to achieve the function for which the hand is there. Two things are different, structural part and functional part. Treatment, medically treated through surgery or medicines, and the other part is through therapies or non-medical means. Wherever there is a structural part involved, wherever there is an involvement of medicines and surgery, it is the ENT, ear, nose, throat specialist who does it. And wherever there is a non-medical intervention required, there is a audiologist and speech language pathologist who is involved in it. The question would be coming, what is the non-medical part? Because all of us know that if there is a pain in the ear, if there is a discharge in the ear, then we get medicines or we go for a surgery. The non-medical part of it is that, as I said, in this particular class, how many of you are wearing specs? You said 7 out of 24. So that is as high as 30%. As vision is a sense, similarly hearing is also a sense. If there is a reduction in vision and people are putting assistive devices, then the hearing issue would also be there if we do the evaluation. But because there is a lot of redundancy and adjustment which can happen to hear things, you can go nearer, the person can repeat. Ram is a boy in that particular sentence. If you hear Ram only, that would be enough because it is a singular thing. A comes with singular, boy, Ram can be name of a boy. So much of redundancy is there. The same thing is not there for the visual input. So you have to compensate it and it becomes very evident. Hearing loss gets missed out because it is not very evident. So what is the non-medical method to treat this? First is do the evaluation, see if there is a hearing aid to be fit. The second is, with the hearing sense, there is a sense of balance. So if there is a issue in balance, vestibular issues, then vestibular retraining therapy is also given by audiologist. The third is if there is a sound in the ear, tinnitus, that is also taken up by audiologist. Non-medical means. Same comes with speech language pathology. If there is a issue in the oral peripheral mechanism, in the phonatory mechanism, that is the larynx, in the respiratory mechanism, or the nerve which are controlling it, which requires medical intervention, the ENT would be there. There are people who have cleft of lip and palate who need surgery, ENT surgeon or plastic surgeon. There are people who get paralysis, ENT surgeon or plastic surgeon. There are people who get ulcers and who get tumors, ENT surgeon. But there are people who stutter. There are people who have issues in articulation. There are people who have issues in voice. There are children who cannot speak. There are adults who lose out their speech. So many people are there now. For them, non-medical intervention or speech language therapy is required. So speech language therapists come into play there, and it is not the ENT who would be doing the non-medical intervention. This way we have understood how an ENT surgeon is or an ENT specialist is different in terms of his work and in terms of his intervention as compared to an audiologist. Clear? Understood? Thank you.